Do you ever wake up to go pee at night?
I did once.
I did once. From now on, you just don't wake up. Hey, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalza.
I'm Dr. Brad Wiening.
And I'm Dr. Peter Ince.
Today, we've got a urologist here. Thank you so much for taking time out of your busy day to share your knowledge with us. And what are you going to tell us about today?
Well, I'd like to talk about the symptoms that a lot of men get after the age of about 50. Those symptoms, where you notice that the stream is getting a little bit slow and you're waking up at night and you got that dribbling after you go. That's what I'd like to talk about.
On behalf of the urogenital system, we want to thank you for keeping things flowing. See, our job is we can get people mobile enough to get to the washroom.
Yep.
But in order to do something, we need your services once they get there. So, what's the acronym for these?
Well, LUTS is what we call it. So lower urinary tract symptoms, LUTS.
And you couldn't think of something to make the C stand for to really make it a complete acronym? Klutz? No.
That's good. That's laugh.
That's good. Okay. All right, LUTS.
Here we go.
Right. So this is very important to understand. People start getting symptoms around the age of 50. So this all occurs because the prostate, think of the bladder as a rubber bag that squeezes the urine out through the prostate. So the prostate is at the bottom of the bag.
Okay.
So the urine's going to flow right through the prostate out through the penis.
Okay.
Now, as you get older, two things happen. That prostate, it has muscles in it, and it starts to tighten. And that starts restricting the flow and causing this whole constellation of symptoms. The second thing that can happen is that it enlarges in size. Not related to cancer, totally benign. It starts enlarging, and as it gets bigger, it also starts growing in and constricting. So two ways it can happen.
And that's what benign prostatic hypertrophy is, or BPH.
Benign prostatic hypertrophy, right. So if you start getting those symptoms, that is not a sign of prostate cancer in the vast majority of people.
Right.
And we have a video, either we're going to release it after this or before this, about prostate cancer. So in this video, we're not going to be discussing prostate cancer per se. We're going to be talking about LUTS and BPH.
So first things first, is there anything people did or could have done to either cause this or prevent this? Or it just happens?
Unfortunately, there's not a lot that can be done to prevent it. A lot of it's just the way you're born, genetics, that it happens.
Thanks, parents. All right, so BPH. So I've found my stream is getting slower, getting up more frequently in the washroom. I go see my family doc, who refers me to a urologist to deal with this. And how do we deal with it?
First thing I do is determine how bad is it? How much is it really affecting you?
Okay.
And a lot of times you find out people are just worried, I got prostate cancer.
Sure. Okay.
Because of the symptoms. And like I said, this is 99% of the time is not related to cancer. It's just you getting a bit older. So once they're reassured, and then you have to determine the severity. How much does it bother them? Mm-hmm. So if they're getting up, once or twice at night, first thing I say is stop drinking fluids, 3 hours before bedtime.
Yeah.
And they go, oh, really? And it's a surprising number of people have a big glass of water before they go to bed.
Well, we tell people to drink a lot of water. I guess we should tell them
I'm saying drink as much as you want during the daytime, but stop 3 hours, 4 hours before bedtime.
Sure.
And you'll find suddenly you're not waking up.
Yeah.
Makes
no more
sense.
water before bed. Just stick to beer.
Fluids, no fluids.
There we go.
So once you do those simple things, if you're still getting problems that you're waking up at night, things are slow, especially in the morning when you wake up, you're running to the bathroom a lot, you feel like you're not emptying. Mm-hmm. When you pee, it sort of comes out slow and then it stops, then it starts, then it stops. If it's bothering you, then there's medications to help. But if you say, you know what, I'm getting up once or twice, it's a bit slower, I know it's not cancer, I can live with it.
Okay, quick question about the medication. We don't have to specifically name them by name, but are there any downsides to taking the medication? A lot of our viewers are concerned about taking unnecessary medications.
Sure. Right, so if your symptoms are on the mild side, I would say start with a herbal supplement.
Okay.
And look for something that has saw palmetto in it. That is a berry which can help relax the muscles of the prostate, and it can be very beneficial. If you go to a reliable health food store, I won't name any supplements, but really talk to friends who've tried things, because usually word of mouth is a good way of going as well, and it does work for those mild symptoms.
There you go.
Then, when they come to me, they've usually tried those things. And there's two types of drugs. One that will relax the prostate muscles, so that's Flomax and Rapaflow. And then another set of drugs which will shrink the prostate and allow a better flow. And that would be the things like Avodart and Proscar.
Okay. So you either relax them or shrink them, or do you ever take both?
Or both.
Okay.
Yeah.
Well, there you go.
Okay.
BPH.
So now I'm taking the pills, took the herbals. I'm still not working. I'm getting up 3 times a night. I don't drink for 6 hours before I go to bed. I cannot live like this. Is there anything more invasive or more definitive that can be done to deal with that?
So once we've tried the medical options and the pills just aren't working, then we have to find a way of getting that channel open.
I think I know where you're going with
Exactly.
this,
So there's literally a dozen or more ways of doing that. So we can, under sedation or totally asleep under an anesthetic.
Thank you.
We can look in through the urethra of the penis, and then we can look into the prostate, and there's ways of opening it up. Either it can be carved out using electrocautery, we can use lasers, we can use thermal microwave probes, we can use jets of water. There's literally a dozen or more ways to open up the prostate, and they all have their pros and cons. So that's something to talk to your urologist about.
Would those all be considered a TERP or a...
No. Well, they're transurethral.
Yes.
But
you're not really removing it.
they're not. TERP stands for resection, which is the classic gold standard of resecting the tissue and cauterizing it.
So it's not a TERP.
Again, just a W away.
Yes, exactly.
Okay, so that's TERP. All right.
Okay.
But this isn't a TERP, not necessarily. This is a transurethral procedure to try and increase the diameter of the tube that
Just
the urine has to go
increasing the
out.
flow. It's very simple physics.
Successful?
It's very successful. The downside is that once the prostate is opened, you lose ejaculation. The vast majority of men will, because the prostate, when it squeezes for ejaculation, has to be able to squeeze closed.
Right.
When you do the TERP, or a procedure like it, it's open and it can only squeeze a little bit.
Okay.
So very little comes out. It just goes into the bladder and it gets peed out. Now, for some men, that's very bothersome.
Right.
And there are procedures where less tissue is removed so that you can preserve ejaculation, but it usually means you'll need another procedure sooner.
Right. Pretty important, obviously, thing to consider before undertaking this.
Boy, we started with a benign entity and now we're
that's a lot.
down the road.
But what's good to know is that this is something that's very, very common. It is typically not related to prostate cancer, which, like you said, is the biggest fear, and is a very treatable thing.
Exactly.
Wow. Thanks again for sharing your knowledge with us today.
It's great. We suspect the things that Peter talked about today are going to really inspire a lot of comments in our viewers and help educate them about taking care of themselves.
And it's Movember, right?
Movember.
It's time to be aware about men's health. That's why we're doing these videos.
Yeah, and go to our channel and go to Movember, our site, and support us to raise some money.
What is it, Movember?
So Talking with Docs under the Movember website, or the app.
Under Movember, go to Talking with Docs.
Yeah. If you like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health, even if you're not in charge of your own prostate.
We'll see you next time.